Hello. What is hypertension? Hyper means high and tension means pressure. Therefore, hypertension means high blood pressure, meaning high tension in the heart, high tension in the arteries and vital organs. Normal blood pressure is 120 over 80 millimeters mercury. Systolic is on top and diastolic is on the bottom. Just remember San Diego. Systolic is the squeeze of the blood vessels and diastolic is the decompress of the blood vessels. So just remember, in hypertension, anything over 140 over 90, the heart says, "Oh lordy." In regard with the values, elevated BP starts at 120 to 129 over 80. Stage 1 hypertension is when systolic is 130 to 139 and diastolic is 80 to 89. We start taking concern when blood pressure gets to stage 2. This is 140 over 90. Remember, the heart says, "Oh lord." Hypertension crisis arises when the BP gets to 180 over 120 or higher. Take note that this is dangerous because it can cause serious problems like brain damage and heart attack. To remember the common causes of hypertension, we use the word SODA. S stands for stress, which includes smoking, sedentary lifestyle, stimulants like caffeine or illicit drugs. O stands for obesity and oral contraceptives. D stands for diet, in which it comprises high sodium and high cholesterol intake. This is because sodium retains fluid in the body, causing high blood volume. Cholesterol, on the other hand, can cause plaque buildup in the blood vessels, causing higher vascular resistance. D also stands for diseases, which we can use the acronym Dr. Double H. Diabetes mellitus turns blood sticky due to sugar. Renal disease keeps fluid in the body. Heart failure causing high fluid retention due to broken heart pump. And lastly, hyperlipidemia causing higher vascular resistance. A stands for African American men and old age. All of these causes leads to three effects that serves as the main factors that impacts high pressure in the blood vessels. First is increased blood volume. When there is more amount of blood in the heart to pump, this significantly increases blood pressure. Second is increased peripheral vascular resistance. When the lumen of the blood vessels decrease due to contraction or obstruction, increased peripheral vascular resistance occurs. This leads to increase of blood pressure. And lastly, increased heart rate. When heart rate increases, the cardiac muscles contracts fast, propelling blood out of the heart quickly, resulting to an increase of pressure in the blood vessels. All of this leads to high pressure in the arteries and to the vital organs, thus we call hypertension. Hypertension mostly does not have signs and symptoms, since it mostly increases slowly from time to time without any signs. This can lead to sudden death, hence the term silent killer. But most common signs and symptoms that may appear are the ABC: achy head or headache, blurred vision or retinopathy, and chest pain, which may indicate a heart attack. Most clinical manifestations occur due to lateral damage caused by hypertension. In imaging studies, hypertrophic left ventricles is highly significant and is commonly found. Just remember, big size trophy size heart. Chest X-ray is used to view the size of the heart. Echocardiogram is also used to view the size of the heart and measure the amount of blood pumped out of the heart. This is called ejection fraction, in which 55% to 70% is normal and 40% or less mostly indicates heart failure. ECG detects tau R peaks, indicating strong ventricular contraction, which means hypertrophic left ventricle. To determine and firmly diagnose hypertension, the physician usually needs 3 blood pressure measurements, each with 1 week apart. For blood labs, an acronym BCC can be used to remember this. B for BNP or brain natriuretic peptides, which can indicate the wear and tear of the ventricles, specifically the left ventricle. C is for C-reactive protein, which may determine chronic inflammation which may cause hypertension. Another C is for cholesterol panel or lipid panel. This can determine if there are any risk of clogged arteries, especially on the coronary arteries. Just remember, all values of the results should be less except for the HDL, where H means high or heaven or happy lipids. The main treatment for hypertension is lifestyle change. Use acronym DRESS to remember these things. D for diet, which is low in SCC, sodium that retains fluid, calories, which can lead to obesity or increased body weight, and cholesterol, which can cause clogged arteries. R is for reduced alcohol and caffeine because these stimulate the heart muscles. E is for exercise while walking for at least 30 minutes a day for 5 days a week. This enhances cardiovascular function. S is for stop smoking and consumption of alcohol. And the last S is for stress reduction. The main goal of medical treatment is to calm the heart and lower the blood pressure or heart rate. An acronym ABCDD can be used for this. A stands for ACE inhibitor that lowers the blood pressure. The drugs under this ends with peril. Just remember that these are chill peril of the heart. The main side effects of this are AC and E. That stands for angioedema, manifested by swollen red tongue, C for cough, and E is for electrolyte imbalances, low sodium and high potassium. Another A is for ARBs, or angiotensin receptor blockers that lowers the blood pressure. The drugs under this ends with tan, like losartan. Just remember that Mr. Tan is a relaxed man. This allows less workload in the heart and more relaxation in the blood vessels. This can also excrete fluids out of the body, lowering blood volume. B is for beta blockers that slows the heart rate. The drugs ends with LOL like atenolol and labetalol. Just remember that B in beta blockers are brakes on the heart, and LOL is L, low heart rate. There are contraindications to be considered in giving these medications. Just remember the 4 B's. Bradycardia is when the heart rate drops 60 or less. Another B is bottomed out BP, which means low blood pressure. Another is breathing problems, like patients who have COPD or asthma, because it can constrict the bronchi. Lastly is blood sugar masking for hypoglycemic patients. Always monitor patients' blood sugar, especially in diabetic patients. C is for calcium channel blockers, which C calms the heart and C controls blood pressure, leading to low BP and heart rate. Example of drugs under this are nifedipine, which ends with pine and rhymes with break time. Another is cardizem, which ends with zem, just like Zen Garden. Also, verapamil that ends with mil. Think like calm and chill. D is for diuretics that decrease blood pressure, drain fluid, and can dehydrate the body. This decreases the workload of the heart. This is divided in two types, which is potassium wasting and potassium sparing. In potassium wasting, examples are furosemide and hydrochlorothiazide. This rhymes with dried. These are only given with patients having normal potassium level, which is 3.5 to 5.0, and not to those who are less of this. In potassium-sparing diuretics, S for spironolactone, that spares potassium. This directly blocks aldosterone to let fluids out of the body. Because spironolactone ends with tone, to think that it blocks aldosterone. Another thing to be in mind, avoid salt substitutes, fruits, and green leafy vegetables when using this, for it can cause increased level of potassium. The other D is for dilators, which decrease the blood pressure by dilating the vessels to decrease vascular resistance. Nitroglycerin is a common drug. Think nitro is like a pillow to the heart. This is contraindicated to patients who are in Viagra or has erectile dysfunction drugs, because this will widen the blood vessels, dropping the blood pressure so low that can cause sudden death. A bonus drug to be given with those hypertensive patients with high cholesterol are these. This decreased risk of plaque and clot formation in blood vessels. Just think AC for anti-clogging of arteries. A is for antiplatelet like aspirin or clopidogrel. C is for cholesterol lowering like lovastatin. These drugs ends with statin. So remember, statin keeps your vessels clean. This prevents production of cholesterol in the liver, so be cautious of liver toxicity. If medication cannot solve the problem, surgical treatments are done, especially to prevent myocardial infarction or heart attack. Just remember ABC. A for angioplasty, which is a stent placement to push aside the plaque to allow more blood and more oxygen to the myocardium. B is for bypass or CABG, which means coronary artery bypass graft. It is creating another way of the blood as a bypass going around the damaged or plaque-filled artery. C is cutting out the fatty blockage in the artery, which is called endarterectomy. Most common nursing diagnoses encountered with patients having hypertension are these: deficient knowledge regarding the relation between the treatment regimen and control of the disease process related to insufficient information, non-compliance with therapeutic regimen related to side effects of prescribed therapy. In nursing management, focus in lowering and controlling blood pressure without adverse effects and without undue cost. This is achieved by increasing knowledge of the patient through education of lifestyle changes and medications. The nurse must emphasize the concepts of controlling the blood pressure rather than curing it. Encourage patients to consult a dietitian to plan a nutrition intake. Explain that it takes 2 to 3 months to adjust dietary changes. Encourage also patients to limit or avoid alcohol intake and smoking habits. Also, emphasize adherence to a therapeutic regimen to control blood pressure and avoid sudden spike if not complied. Assist patients to adhere and develop a plan of change in their treatments, especially lifestyle change. Encourage follow-up visits to monitor patients' progress with the treatments given. Also, promote home and transitional care, emphasizing patients' self-care. Monitor and manage potential complications to patients that show symptoms of progressive hypertension. In hypertensive crisis, this occurs when systolic is greater than 180 and diastolic is greater than 120. This is divided into two, which are hypertensive urgency and hypertensive emergency. In hypertensive urgency, there is no damage seen and observed to end organs including brain, kidneys, heart, and lungs. On the other hand, Hypertensive emergency shows damage to end organs. Symptoms of emergency shows confusion, drowsiness, chest pain, and breathlessness. Untreated hypertension is very dangerous as it can lead to death mostly without any signs and symptoms, hence the name silent killer. Mild to moderate hypertension, if left untreated, may be associated with a risk of atherosclerosis disease and organ damage within 8 to 10 years after onset. But with proper treatment and adherence to medication, hypertension can be controlled. That's all. Thank you, and I hope you learned something.